Understood. Normal sinus rhythm. In this lesson, we will discuss normal sinus rhythm, or NSR for short. NSR is considered the normal electrical rhythm of the heart, originating from the sinoatrial SA node. The sinoatrial node, or SA node, is a small region of specialized cells located in the right atrium of the heart, responsible for initiating electrical impulses. A normal sinus rhythm can be recognized on an electrocardiogram, ECG, by the presence of a P wave before each QRS complex, and AT wave following the QRS complex. As aforementioned, the ECG waveform consists of several waves. The P wave represents atrial depolarization, which is the electrical activation of the atria. It's the first wave in the ECG and is usually a small, rounded wave. The QRS complex represents ventricular depolarization, which is the electrical activation of the ventricles. It's a combination of three waves, Q, R, and S. The Q wave is usually small and the R wave is usually the tallest of the three. The T wave represents ventricular repolarization, which is the electrical recovery of the ventricles. It's usually a dome-shaped wave. There's also a wave called the U wave, which represents the repolarization of the papillary muscles and the Purkinje fibers. It's usually a small, rounded wave that follows the T wave. A normal sinus rhythm typically ranges between 60 and 100 beats per minute and maintains a regular rhythm. A normal sinus rhythm can be further categorized into different rates, with a heart rate of 60 beats per minute being within the normal range. Similarly, a heart rate of 100 beats per minute can also be considered a normal sinus rhythm, as long as the rhythm remains regular. In summary, normal sinus rhythm is considered the normal electrical rhythm of the heart, originating from the sinoatrial node. A normal sinus rhythm is recognized on an electrocardiogram by the presence of a P wave before each QRS complex, and AT wave following the QRS complex. The normal range of heart rate for NSR is typically between 60 and 100 beats per minute, with the rhythm maintaining a regular pattern. Thank you for participating in this medical department educational video. This video was brought to you by the SCPF Medical Department Medical Student Educational Services.